Hey everyone, I hope everyone is having a great weekend. Today I'm going to be chatting about pregnancy, the glycemic index, and blood sugars, and I'm super excited to chat about this because this is something that I talk about all the time and it's really important, especially in pregnancy. So for those of you who don't know me, my name is Jessica Pumple. I'm a registered dietitian and a certified diabetes educator and a certified bariatric educator. So before we get going, I'm just going to make sure that I can see all the comments here so I can answer live. All right, and I think that we are good to go. Okay, so yeah, I should be able to see now. Okay, so the glycemic index is a scale that rates foods on how much they increase the blood sugar. So the carbohydrate foods are the foods that increase blood sugar. So this is going to be your grains and starches like bread, pasta, rice, potato, as well as all of the fruits and the milk and alternatives, and then of course the foods with added sugar as well. So these are the foods that increase your blood sugar, and the glycemic index rates them on how much they increase your blood sugar. So foods that are low in glycemic index, so if we have a scale, a low glycemic index food might only raise your blood sugar this much, but the same amount of carbohydrate of a high glycemic index food might raise it this much. So if we're trying to have good blood sugars, which is definitely beneficial in pregnancy because those blood sugars can pass through the placenta barrier to our baby, then it's beneficial to try to choose the low glycemic index foods as often as possible. So which foods are low in glycemic index? They tend to be the foods that are less processed and higher in fiber. So when we eat foods, fiber actually slows down the absorption of this carbohydrate or the sugar into our bloodstream and lowers that or blunts that effect on our blood sugar. So low glycemic index foods are going to be stone ground whole wheat bread, al dente, whole grain pasta, sweet potato. Those are some of the low glycemic index. The medium glycemic index is going to be whole wheat bread, quick cook oats, and the high glycemic index foods are going to be usually the white grains and starches, sugar, bagels, and things like that. So white bread and glucose are 100 on the scale, and then it rates foods below that. So anything over 70 is considered a high glycemic index food, between 55 and 70 is medium, and then below 55 is low glycemic index. So as often as possible we want to try and be below that, or at least in the medium range. So if you're on my email list, this week I'm going to be sending out a table, an inclusive table of the glycemic index foods, also a 3-day pregnancy meal plan that's low glycemic index. And so if you're on my email list, then you'll get that. But you can also Google what is the glycemic index of the food and try to be 55 or below, or at least in that medium range. So in pregnancy, it's beneficial to follow a low glycemic index diet because like I said, those blood sugars can pass through the placenta barrier and your baby can be getting those extra blood sugars. And if the baby is getting more sugar, it can actually grow bigger. So we know that maternal high blood sugars, or high blood sugars of the mother, can actually cause our babies to grow bigger, which can be increased risk of postpartum hypoglycemia. So the baby has high blood sugars when it's in the womb, and it's producing extra insulin to keep up with it. But then when the baby is born, it doesn't have that high blood sugar, but it's still producing insulin to try to keep up with the high blood sugars, and it can actually have a low blood sugar after it's born, so that's not very safe for the baby as well. So other complications of high blood sugars are going to be higher risk of C-sections, preeclampsia, like I mentioned before, a macrosomic baby, so over 9 pounds or 4 kilograms, as well as increased lengths of stay in hospital for both the mother and the baby. So most women, or all women now, between the weeks of 24 and 28 weeks are supposed to do their glucose tolerance test. So this is going to determine whether the mother has gestational diabetes or not, and if they have gestational diabetes, then they're going to go ahead and get treatment and they can absolutely have a healthy baby. However, there are some studies that are showing that even blood sugars that aren't at the diagnostic level, they're still having those increased outcomes of preeclampsia, higher risk of C-section, and a bigger baby as well. So even if you don't get the diagnosis of gestational diabetes, you still want to be mindful and try to eat as healthy as possible and choose low glycemic index as often as possible. So one study in particular called Impact of Increasing Carbohydrate Intolerance on Maternal Fetal Outcomes. They looked at 3,637 women that didn't have gestational diabetes, and the study found that it increased those risk factors as well. There's also a study called the HAPO study, or the Hyperglycemia and Adverse Outcome in Pregnancy study, and it looked at 23,000 women, and again it shows that the higher your blood sugar, the higher that your increase, and it goes on a gradient, and so we just want to try to have the best blood sugars as possible during pregnancy. There's also 2 different glucose tolerance tests that you can do. So the HAPO study recommends one that actually is a little bit more strict, and it picks up on more women. So in their study, it picked up that actually 16.1% of women were diagnosed with gestational diabetes. However, in Canada, they've got 2 approaches, and physicians can pick which approach that they want to pick. And so Diabetes Canada has called sort of the one with not as strict regulations, that only picks up on about 8.8% of women, as they've called this the preferred approach, and the one that catches more women with the diagnosis is called the alternative approach. So also to my email list, I will send out what the numbers are to make sure that if you're doing your glucose tolerance test, that you can actually see the cutoff numbers and see, make sure that you're falling within the, making sure that you're not being missed in that 8.8 to 16.1% of women that are actually getting missed when they're doing their glucose tolerance test. So I had another question. So if your favorite foods are high in glycemic index, what can you do? Because the answer can't always be to cut it out. And again, it's not necessarily one high blood sugar that's the problem, but high blood sugars over a period of time that can increase your risk. So if your blood sugars are running high and they continuously run high, then that blood sugar is going to go through to your baby. So if some of your favorite foods are high, of course limiting how often you have them and limiting your portion size can also decrease the glycemic load. But if some of your favorite foods are high in glycemic index, if you're having them with foods that contain fiber, so let's say you added a salad to, let's say one of your favorite foods is dates. One of my favorite foods is dates. So if I was going to have dates, if you had a salad or you had some vegetables or fruit with fiber in it, that can actually lower the glycemic index of the high glycemic index food that you're eating. Also, if you add protein and fat, so if you're having it in the context of dessert after a meal, it's going to lower the glycemic index of the entire meal. The other thing that you can do is add an acidic food. So if you're having salmon and you're sprinkling lemon on it, that's going to lower the glycemic index of the whole meal. And also we know that exercise really helps move sugar from the blood into your muscles, where you can use it for energy. And so if you had something that was more carbohydrates or high in glycemic index, and after your meal you went and you did some exercise, that can help you lower your blood sugars as well. All right, so if anyone has any questions, they can put it in the comments, or they can message me and I can hop on and answer them later. And so I'll post this video after if you had any questions after. And if you were interested in getting a table of the foods and their glycemic index, or a 3-day pregnancy low glycemic index diet, you can sign up for my email list. So I'm going to put that above when I repost the video. in the description, and I'll also put it in the comments below. Okay, well, I hope that everyone is having a great weekend and that you found that helpful, and I will see you next week. And next week I'm going to be talking about exercises in pregnancy, including which exercises are not safe to do and which exercises are good to do. All right, hope everyone has a great week. Bye.